Okay, Emily, when you're ready, you can go ahead and you should be able to share screens and share your screen with us.
All right. Well, can everybody see that?
Yes.
Okay, perfect. Well, hello, everybody. Good afternoon. My name is Emily Hock, and I am the project manager for the Whitmore Lake Health Hub from the University of Michigan School of Nursing. I do want to talk a little bit about who and what we are at the Health Hub, the Whitmore Lake Health Hub. It is a collaborative initiative involving the University of Michigan School of Nursing, Whitmore Lake Area Human Services, and Hamilton Community Health Network. And our mission is to address health inequities and enhance social determinants of health within the Whitmore Lake community. So there we go. This collaboration is dedicated to integrating healthcare services into local spaces, improving access to care, and fostering robust community engagement. And by working together, we aim to address critical health needs through strategic partnerships, ensuring sustainable and lasting impact. The Whitmore Lake Health Hub is supported by a University of Michigan Community Health Services grant, initially funded in July of 2023 and continuing through June of 2026. Additionally, our partners at Hamilton Community Health Network, with the support of Senator Sue Schink, have secured an additional $1.5 million in funding from the state of Michigan to bolster our sustainability efforts. And our main approach at the Whitmore Lake Health Hub is different from traditional models of healthcare in that rather than centering health services and wrapping community supports around them, we center community institutions and the services they provide, integrating health programming and primary care access into those already established structures. So this does a few things for us. This ensures that we are not merely grafting healthcare onto the community, but embedding it within the very framework of these community supports. By leveraging trusted community institutions such as our local food pantry, schools, and social service agencies, we can meet people where they already are, both physically and emotionally. And this is impactful because it builds trust and familiarity, and it builds on the trust and familiarity that's already there. Our community members are often already have established relationships with these institutions. And by integrating healthcare services into environments they trust, we lower barriers to seeking care. It also allows for a more holistic approach to healthcare. Individuals can access primary care services while also addressing other social determinants like social determinants of health, like food security, education, and housing all in one place. And it increases access by embedding these services within existing structures. We make it easier for people to access the care they need without an additional hurdle of seeking out a separate facility. And it also empowers the community. This model amplifies the role of community institutions, empowering them to take an active role in health and well-being of their constituents. And so I'd like to take a brief moment to explain our community engagement conceptual framework. This really guides our efforts in connecting with and supporting the community. It consists of 3 stages. So we have our pre-engagement stage. At this stage, community members are not engaged in healthcare systems. They might be routinely using the food pantry or experiencing high levels of food insecurity, but often they lack established healthcare connections. And our goal is to move people through these stages of engagement. Early engagement here, individuals begin interacting with our team, engaging with our nurse practitioner at the food pantry. They might start to recognize or express concerns about their health issues. and then think about visiting the clinic to address an unmet health need. And then fully engaged, this stage individuals are actively and routinely using the healthcare services provided at the Health Hub. And so in us understanding and applying this framework, we tailor our outreach and our support strategies to meet individuals where they are and promote a pathway towards regular healthcare engagement and overall well-being. And so our project is structured around 4 key pillars, each of these integral to achieving our mission of addressing health inequities and enhancing the social determinants of health within the Whitmore Lake community. This slide illustrates our project scope with the timeline at the top that spans from 2023 to 2026. And so for food pantry embedded health services, we integrated health services directly into the Whitmore Lake Area Human Services Pantry operations in September of 2023. Our Whitmore Lake Health Hub at 10 Jennings. This is the establishment of our dedicated clinic at 10 Jennings Road. And this is central to providing continuous comprehensive health services. And then as we move on, we move to primary care and behavioral health outreach to the Whitmore Lake Public Schools. We really want to focus on extending health services to students at the public schools and integrating not only primary care, but behavioral health into the school systems. And then our seniors intergenerational programming fosters intergenerational programming that connects senior citizens with high school seniors. So these pillars together create our comprehensive framework for the project, and it ensures we address health needs across various segments of the community, whether it's through direct health services embedded in everyday community institutions or outreach to educational institutions or innovating an intergenerational program. They all play a key role in enhancing the health and well-being of the Whitmore Lake community. And with that, I am going to hand it off to Ramona. She's going to tell you a little bit more about the Whitmore Lake Area Human Services and what we have been doing there.
Hello, I am Ramona Meadows. I'm the Managing Director for Whitmore Lake Area Human Services. If people aren't aware, we are on the northern border of Washtenaw County, and we do bleed into Livingston County. So we do service both Washtenaw and Livingston County. We are primarily an in-person food pantry. We're open from Tuesdays from 10 to 5, but we also deliver to 40 other families on Mondays. We have grown since starting all of this with the Health Hub. We've grown from 40 in-person families a week to over 100 in-person families a week. So the word is definitely getting out. I was hired here 18 months ago. I was told we were at least 3 years away from having the health clinic in Whitmore Lake, and it just opened 2 weeks ago. So that's how you get things done. And when you have a really good partnership and how everything really works out and people want to get involved. This slide here shows what Jen has been doing in the clinic. She comes in on Tuesdays. It took a while for our neighbors to open up to her, to even look at her, I would say, to speak to her. But now she has really solid relationships with a lot of them. She does a lot of diabetes and high blood pressure things. And she also deals with stress management. And she's also helped, we have a large family, and she's also helped them to be able to get some services that they need for their children. So it's really been a great opening to the clinic and allowing people to get used to having a person from outside of Whitmore Lake helping them. We continually do surveys with clients to keep them engaged each week. One of those surveys made us realize that our pantry is a place for people to feel connected and something to belong to, and we took that to heart. So the next slide will show we have gone along with our Wellness Beyond Food theme, and we've received additional funding that allows us to have classes in the pantry. So you can see here we have cooking classes that we have being taught by University of Michigan nutrition students. The criteria for the recipes is to use food that we have available in the pantry regularly. It's been great to see the different types of meals they've come up with. The first two, it was a real Southwest theme. I think the next couple, we're going to have an Asian and Italian theme, I believe. They were coming up with the recipes now. We also have weekly chair yoga classes. These classes on Monday night are our most attended classes. They're from 5 to 5:45. People love them. The instructor's great. We have people from their 20s to their 70s attending these classes. It's been really great. And lastly, we have nutrition classes. We had a 3-part seminar over the summer, and we are now going to have students from the University of Michigan coming in and coaching healthy eating and shopping healthy. It's just another way that we've been able to partner with the University of Michigan School of Nursing and the nutrition department. The past few summers, we've also provided free sports physicals for Whitmer Lake children. In 2023, we performed 33 physicals, and then this summer we were able to increase it to 55. That was in partnership with the University School of Nursing, and the feedback from every parent that I know has been fantastic. I just believe it's going to grow again next year. We also were able to help Hamilton Health. They used some of our resources, and they were able to offer physicals for Flint children. They also had an excellent turnout, and it was great to be able to partner with them, even in another county. So I think the next, there you go.
Yeah,
Back to
so
Emily.
I'm going to talk a little bit more about our clinical partner, Hamilton Community Health Network. They are a respected, federally qualified health center established over 40 years ago, and they play a critical role in our efforts to address health equities in Whitmore Lake. I think the biggest thing with partnering with a federally qualified health center is that they accept Medicare, Medicaid, and private insurance. Most importantly, they offer a sliding fee scale, assuring that all of our residents can receive care regardless of their ability to pay. So this financial accessibility really helps remove and reduce barriers to healthcare. Teaming up with Hamilton Community Health Network not only amplifies our efforts, but it ensures a higher quality of care that's equitable and accessible. They have a long-standing commitment to serving underserved populations. They have comprehensive service offerings and accessibility measures within their network that has just made the Health Hub even more successful. So I think what is foundational to like our mission for the Health Hub is our partnerships and the strength of our partnerships to create a healthier, more engaged community where every individual can access the care they need, especially regardless of their financial situation. And Ramona did talk about our clinic that opened just recently. So we are accepting new patients. We have primary care, behavioral health, wellness visits. And again, just to stress that the sliding fee scale really is crucial to making all of this work. So that is all that we have. I will say thank you for letting us talk a little bit about our project that we are so passionate about. And if we want to go through questions. If anybody has any, we're happy to do that.
I'm not seeing any in the chat right now. I did have kind of a curiosity. The seniors, I just saw Lisa has posted any information about the seniors program. We start there.
So we haven't started that just yet. So that's going to be, we're going to get into the nitty gritty of that hopefully in the next 6 months or so. But I'm happy to share anything with Stacy once we have it so that it can be shared more widely.
And then that's something, yeah. The next question here was with the flyer. And if there's a flyer to share with families.
I can share the clinic flyer. Ramona, I don't know if you have a brochure that you want to share also. And then as far as contact, I can put my email in the chat. And if anybody wants to reach out to me with any additional questions or if anything comes up in the future, please don't hesitate.
Do you work with Tammy Averill at the senior center, the community center there?
Yes,
yes.
we do. Yeah. She's right across the tracks, actually.
Yes.
So yes, we do work with them. We have found out that clients who visit her or neighbors that visit her location don't visit mine and vice versa. So we are trying to bridge the gap between the two.
Interesting. Yeah. I have a long work history with senior nutrition and with working with Tammy with the senior meals, the Meals on Wheels program. So
yeah,
that's
she
nice
does a
to
lot
hear.
of great things. Lots
She
of great
does.
things.
Yes. And congratulations on opening up your facility 2 weeks
Thank
ago.
you.
Thank you.
Thank you.
Thank you so much.
Do we have any other questions? Should we wrap this up? Yep, I can definitely share on the listserv. Emily, both of you and Ramona are welcome to post share on the listserv too, the Barry Bester listserv, any of the flyers or any updates, program updates that you have.
Great. Thank you.
Okay. Thank you. Vanessa, I think that we can go ahead and move on to your screen. You can share your screen with us.
Right. Okay.
And then just as a reminder, we're going to have everybody encourage you all to put questions into the chat, and then Vanessa can address them at the end of her presentation, or unless Vanessa wants to stop in the middle and ask questions in the middle of it. But we'll focus it at the end.
Either one is fine. Feel free to interrupt me if you do have a question while I'm going along. So my name is Vanessa Armstrong. I am a community nutrition instructor with Michigan State University Extension. I serve Lenawee and Washtenaw counties. My home office is here in Lenawee County, but I am often in Washtenaw, and I live kind of in the middle, so I get over there as often as I can. We always like to share that MSU is an affirmative action, equal opportunity employer. MSU Extension programs and materials are open to all without regard to race, color, national origin, sex, gender, gender identity, religion, age, height, weight, disability, political beliefs, sexual orientation, marital status, family status, or veteran status. So I work under the Expanded Food Nutrition Education Program. That's just the grant that I work under. So you don't really need to know that. What you should know about my programming is I serve parents that are feeding children in the home. That is my target audience for adults. That could also be grandparents that are raising children or helping to raise children, even aunts and uncles if they are feeding and buying food for kids on a regular basis. Those are the folks that I am serving. They should also be eligible to receive SNAP or WIC benefits. Of course, we are never going to turn anyone away because our programs are open to all, but those are the audiences that the grant wants to serve. We also will serve pregnant and parenting teens. I do a lot of youth programming, primarily in Lenawee County. Occasionally, I do some Washtenaw County youth programming, but the majority of my youth programming happens here in Lenawee County. And pregnant women are also eligible for our programs. Our classes are based around MyPlate. I am not a dietitian. I am a peer, although all of the curricula that we use for our programs are evidence-based. So they are based in science. They have been developed by either us or other universities within their extension programs. They are typically 6 weeks. Like I said, the basic nutrition information is based around MyPlate, so it's all very basic information. There's usually a physical activity component. We talk about the importance of physical activity. We try to include a stretch break in every class. We touch on food safety. In my youth classes, that can be as simple as washing hands. Adults, we're going to talk about thawing meat at the proper temperature, or cooking meat to the proper temperature, or when is the best ways to thaw your meat, that kind of thing. So, and then there's usually a food or cooking component, a tasting or cooking component in every class. Every elementary classes, I bring in a tasting. Adult classes, we tend to cook every week. Okay, so we have several, like I said, there's a lot of curricula we use. I tend to teach Cooking Matters a lot over at the farm at Trinity Health. I have one starting in a couple of weeks. It's a hands-on cooking and nutrition program. As I mentioned, most of our programs are very similar. They have very similar themes. So there are a lot of different iterations of Cooking Matters, parents, families, and at home. At home is a virtual program. Families is usually one adult and one child. This one is very tricky. I do not teach this a lot because, as you can imagine, the dynamic for me alone to teach parents and children, it can be a little tricky. It's usually a much smaller group. And we will cover budgeting, cooking those healthy meals, trying to stay within your budget, how to utilize all those resources you may have access to, whether that's SNAP or food pantries or WIC. We want to make sure you're utilizing all of your food benefits, right? So, and then Cooking Matters at Home is just really kind of a condensed version of that. Cooking Matters for Families, we talk a little bit about all of that and how to incorporate the kids in the kitchen too. And then I have a couple of short videos that you can see just some of the recipes, a couple of the favorite recipes that we make in Cooking Matters classes. This is a mango salsa. It's one of my favorite Cooking Matters recipes. I have often eaten this all by myself, the whole recipe. So always a favorite. And here is just another quick one that we also often talk about making food at home versus fast food. This is kind of a quick chicken nugget, chicken tender recipe, a little bit healthier. So we like to share this, and it always goes over. If we make it in a kid class, they love it. Adults tend to love it as well. And if you're curious about either one of those recipes, you could just look up Cooking Matters Mango Salsa or Cooking Matters Baked Flake Chicken. They'll come right up in Google. One of the other unique things about Cooking Matters classes, if we have funding, which we do not always have funding, or if a partner agency would like to host a class, sometimes we are able to send home take-home groceries with participants every week. And those would be the recipes we prepare in class. They get those ingredients to take home as their homework. Like I said, we don't always have funding for that, but when we do, they will get a bag of groceries for whatever recipes we've made in class. Prior around the last couple years, it's been a little trickier to do 2 recipes. Sometimes I can do 2 recipes for them to take home. Sometimes it's just 1, depending on what recipes we're making. But that is one of the unique things about Cooking Matters classes, that sometimes we are able to offer take home groceries. And there's a grocery store tour week 5 where we go to the grocery store and they have to use the knowledge that they've gained over the previous 4 weeks and complete a $10 challenge where they have to make a meal for a family of 4 for under $10 using all 5 food groups. Okay. And then we have other curricula, like I mentioned, Healthy Choices for Everybody is it's a newer program that we have. It's really nice because it's kind of customizable based on your audience. So there's better beverages, feeding little bodies. So if I have a class of parents that have older kids, I'm not going to include this lesson. But if it's a bunch of younger parents, then we would include that. Healthy, affordable meals. There's a healthy cooking. So if I'm getting a lot of inexperienced cooks, we may include that lesson. How to read food labels, learning those key messages about all the food groups, how to keep your food safe, physical activity recommendations. Another program we have is Today's Mom. This is geared for expecting mothers, and usually that first year with when they're still nursing, but it goes through a lot of different topics. I know this is a pretty busy slide, but you know, how the baby's growing, making healthier choices at fast food restaurants, meal planning, substances that could be harmful during pregnancy, food safety for you and your baby. You know, there's a lot, at least when I had kids. I mean, my youngest is not so little anymore, but there were things you weren't supposed to eat when you were pregnant. So we go through a lot of different things like that. And then I have a couple classes starting, and you may, if you were on the listserv, you may have seen these slides. Oops, sorry about that. Goodness, my PowerPoint is being finicky this afternoon. Okay, well, I'll get to them eventually. I have Cooking Matters at Home starting October 2nd, I believe, which is a Wednesday. There it is. So next week, registration for that closes Friday. This is a 1-hour virtual class, 45 minutes, depending on how interactive participants are, because it is virtual. It's only 5 weeks. And then we have a Cooking Matters for Parents starting at the farm at St. Joe's or Trinity Health, the 21st of October. We are not currently offering the take-home groceries for this time out, but we are offering incentives this year for graduation. So if participants complete 4 of the 6 classes and do their pre and post paperwork, because we're grant funded, we need all that data. They can choose from an electric skillet, a crock pot, a rice cooker, a pizza stone, or a utensil set. Those electric skillets have been very, very popular this past year when we piloted this program. So I'm not closing registration for that for a few weeks. And then Extension offers a lot of other programs other than just what I offer. We also have another instructor in the office that does nutrition education as well, that's under the SNAP grant, who covers all ages. And she also does some policy, systems, and environmental coaching. If that's something you are in need of, or your site, she would be one to contact. We have Master Gardener hotline. We have early childhood development and parenting classes, social emotional health programming occasionally. If we don't have it here, other parts of the state have it, and sometimes we have access to those virtual classes, which is one of the nice things that came out of the pandemic is we have access to a lot more things now in different parts of the state. Youth development, home preservation for foods, financial education, home buyers education, mental health, first aid for youth and adults, and the Serve Safe program. And then here's my contact information. If you have any questions or want to reach out. And then again, check our website, check our Facebook, any of that. If you're curious about what other programs, I can't even tell you all the programs because like I said, we access everything in the state. So there's so many that I'm not even aware of. Okay.
It looks like we have a question. Dawn, are you referring to this program here? Where's the location at Washtenaw County? Where do you
Yes.
have these classes?
The class that we have coming up will be at the farm at Trinity Health. It's over by the really close, it's at the hospital, essentially, just past the EMU football stadium. But I can go pretty much anywhere. If we have at least 5 adults signed up and they are that target audience, we can take a mobile kitchen and we can go on site. Really, I like to have somewhere to wash hands and a couple of tables, but we have induction burners and I bring all my equipment with me. So I can be very mobile.
Thank you.
Mhm.
Any other questions? Hey, well, thank you, Vanessa. That was great.
Yes, thanks for having me.
I'm going to go ahead and share my screen now. I have a preference for PDFs instead of PowerPoint, just navigating them. So I'm just going to share my screen here. Here's our agenda. And what I'm going to go through is our Barrier Busters funding and what that looks like right now. For those of you that make Barrier Buster requests, you probably are aware of, we are out of money and we've been out of money. It goes really quick. So here's what it looks like. On the first of each month, if you look at the bottom here of the breakout and the breakdown, we are allotting, we have the funding pot, and what we're doing is we're designating so that each month we have funds available to the community. So we've got the breakdown, and that will occur on the first of each month. So in fact, I apologize. I didn't update this because it was all zeros and I didn't look at the side. But October 1st, not September 1st, but October 1st, we will have our next allocation of funding. And so all of these, we will give, 14.5 will go to the general fund and follow this breakout list here. What's happening, so if you want to put in a request, what we're asking is kind of a first come, first serve situation. So if you have clients, do it in the morning, have their request ready to go and put it in. What we found in September is that our funding was depleted by 1 o'clock that day. So do it early. We're getting it in. We get pages and pages of requests kind of all at once, and then we have to kind of stop and then go through all the requests. So please go ahead and do that, and then we'll get back to you and be in communication within 24 hours of that request. But we are running, our money is just very tight, and there is so much need in the community that it's just going really quickly. Are there any questions that I can directly answer to this? I'm gonna unmute. Okay. I am gonna go ahead. So that's pretty much it here. I don't have too much more to say other than go ahead and put in a request. If you have any questions ahead of time, reach out to the Barrier Buster listserv or Barrier Buster email address, the BB staff email, to reach all of us, and we'll get back to you. Sometimes access to Encompass, the portal, drops accounts and we have to kind of reactivate them. So if that's occurring, reach out to us. We can get you signed back in, so you're ready to make that request on the 1st. And if you have any other questions regarding requests, you can always reach out to us. Okay, if there's no other direct questions, give it a couple of minutes and we can wrap up our day for our meeting. Okay. All right. Hi, Jasmine. Yep, thank you. All right, I'm going to go ahead end our meeting. Everyone have a good rest of your day, and be in touch if you have any other type of questions. All right, thank you, everyone. Bye-bye.